pledge allegiance to the flag
the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Public comment. Kim, did anyone sign up? No public comment. Approval of the May 4th, 2022 Public Safety Committee meeting minutes.
Lamont moves.
Lamont moves.
Yep.
A second.
And then a second. All in favor, signify by saying aye.
Aye.
Any opposed?
Aye.
Motion carried. Policy issues, discussion, potential committee determination. None. 6, operational functions required by statute, ordinance, or resolution. Report on jail tour and examination required by statute 59.54 subsection 15.
This is Administrator Leonard. Thank you, Mr. Chair. And Sandra is here. We had several members of the committee participate in the statutorily required annual jail tour, and you do have within your packet the materials referenced within the statute, essentially the roster of the jail. Sandra provided a great deal of information to the committee, but if there are any questions, she is certainly available and able to take them at this time, Mr. Chair.
Any questions for Sandra? I'd like to thank you for the tour. I've been on it a couple of times, but every time you learn something a little new, so. Anything for Sandra? All right.
If I may, Mr. Chair, if there are pursuant to statute, as this committee is vested with this responsibility under the statute, if you do believe that any provisions of law have been violated or neglected, you shall immediately give notice as provided by the statute. But I think Sandra did a great job on the tour and addressed, you saw the jail inspector there making that annual walk through the jail and providing all that information, but just reminding you of your statutory obligation under section 59.54 sub 15. Thank you.
Thank you, Administrator Leonard. Oh, number 7, educational presentations. Thank you, Sandra. Educational presentations, outcome monitoring reports, presentation on delivery of jail medical services.
I'll tee it up and then Sandra will give you all the more important information, but you'll probably ask, well, why is this here? First, it's here for education, just to make you aware of a couple of pieces. But if you recall back to your presentation from the Counties Association, you might ask, well, why are we talking about how jail medical services are delivered at this committee when that sounds like a how? That's a staff responsibility, right? You guys decide why we exist, big picture goals. You set goals and objectives. We are the staff or the how people. Well, the reason we are here today to provide you this education, Sandra will give an overview of kind of what the impetus was to us looking at changing the manner in which we delivered those services, essentially moving from a contracted service relative to jail medical, which we talked about on the tour, to a direct service provision, which is we hire our own staff to do it. And you're right, that is a how question, but under your ordinances, if we're ever gonna add positions, you have an ordinance that requires staff to bring that proposal to you and seek your approval at not only the standing committee level, which would be this committee, but then also HR, Finance, and Property, and the full board. So yes, while it is really a staff responsibility, an operations question about how we deliver the services we're required to deliver, your rules nevertheless say, hey, staff, if you're gonna change the how in this circumstance, you need to bring it to us as policymakers and go through a standard process. So with that background, Sandra, if you can address kind of what is jail medical services and why does the jail have to provide them, what our current state has been, and kind of what we've done in the last couple of months and where we are.
Sure, so thank you again. So historically, we have been provided a vendor service by a company that is provided and specializes in jail medical services. So essentially in the Marathon County Jail, we have usually 4 full-time nurses, a nurse practitioner or a physician's assistant at times, and then we have physician oversight. So in addition to that, we have psychiatry, and all of those services are bundled together, and typically we contract for that service, and then we renew or review those contracts through the RFP process. And we went through the RFP process in late 2020, and we elected a new vendor that began their services December 2020. During the last year and a half period, the vendor has gone through some different issues, and I had brought what I believed were some very significant concerns to our Corporation Council, not only in regards to local services and the fulfillment of the contract, but also in regards to the general use of the vendor based upon some different impacts that their licensure had in another state, so in the state of Minnesota. And based upon some directions from Corporation Counsel Perner, we brought the information to Administrator Leonard, and we started the process of identifying where our risks were, how we can mitigate that risk, and what it would look like moving forward, either with that vendor or away from that vendor. During the time, we have seen significant staff issues. We have some concerns regarding what could go wrong, right? So we haven't seen any problematic responses to inmate needs. So we're safe in that regard because we do have good staff on the ground with knowledge that can provide the services. But vendor-wise, we have determined that we need to move away from the vendor that we currently have. So our contract was originally for 3 years. We did issue notice to them, and our contract will cease to exist as of July 26th of this year. In order to provide the best amount of information that I could in a timely manner for some feedback and direction from not only the sheriff and the chief deputy, but also from County Administrator Leonard and Corporation Counsel, we went in a couple of directions. So the first thing I did was I put out a request for proposal for the same services, and we received 2 responses. That was last week on Friday. In addition, I was asked to come up with a business plan, what it would look like if Marathon County were to embark on providing these services for the inmates on their own, with their own employees. I guess rewinding all the way back, I did miss that statutorily the sheriff is charged with providing adequate mental health, medical, and emergency dental care for all of those that are a responsibility. So after presenting all of those options, I believe that we have come up with an idea of utilizing once again a vendor to provide these services. But again, we calendared and came in front of this committee because depending on where those requests for proposals came back and what the dollars were going to look like, we had an opportunity, and we still have a plan that we can put in place to ask the county to utilize the dollars that are there to fund their own employees and their own medical system. So that is what we've been up to. That is the reason that we're calendared today, because we didn't know if we were going to come in and ask you to support the addition of new employees or not.
I just want to thank Sandra. She did a fantastic job, and she laid out exactly kind of why you're here. I just met this morning with, I know Chad and Sandra met earlier to talk about kind of that business plan, but we wanted to make sure if we're going to go the route of direct service, we knew, at least I felt like I knew, that the county board is going to ask, well, what would it look like if we did go out to contract again? So Sandra did a great job, again, essentially going out and putting out another request for proposal to see what the market will bear in terms of cost and service delivery, to make sure we're delivering on our statutorily required obligations. And then if we weren't going to do that, if that was cost prohibitive, what would it look like if we did it internally? I think we're pretty confident we have a plan in place where we would continue with another vendor, but I'll be very upfront with you. I think there's a lot of merit to looking at what Sandra has laid out in terms of a direct provision of services by county employees. So our next step is, we have a lot of good bones with the business plan. I'll be working with Chad and Sandra, and a lot of the heavy lifting is gonna be Sandra for sure, 99% of it, but trying to better quantify some of those other costs that maybe we don't understand. For those of you that went on the tour, you saw a lot of the work that Sandra and her team do to move inmates for a whole variety of reasons, but one of them is medical, dental appointments, and trying to better understand some of those soft costs that we have in terms of reallocating staff, so that we can add some additional meat to the bones of that business plan. But she did a fantastic job. Right now, I don't believe I'm gonna be bringing forward to you before July, the end of July, which is not all that far away. That's why we tried to get in front of you pretty quickly. But I'm not confident that we're gonna be before you asking for the addition of about a dozen employees if we were gonna do this ourselves, because as Sandra laid out, you'd need to have certain medical professionals on staff. And because the jail doesn't operate on the same hours as the courthouse, it's a 24/7 responsibility that the sheriff has, that we need to have that augmented staffing plan. But she did a fantastic job just making you aware of some of the difficulties. It's not fundamentally different from a lot of the other concerns. If you're trying to outfit a room, we talked about outfitting a room with electronic equipment, whether it's equipment, capital, or staff. The market is such right now that there are some challenges, and I think Sandra did a great job kind of evaluating what our best course of action is in the short term. But long term, I think we still have some choices to make, and staff will bring back a recommendation if those change. But you won't see, if we continue in the current service model delivery that is contracting with someone, you won't see anything in terms of a contract that's not a policymaker role in terms of reviewing contracts or approving those. That's an administration responsibility. But should we have moved in the direction of direct care based on your rules, that's why we wanted to get in front of you. So happy to take any questions right now if you have them, but again, I think Sandra did a fantastic job, not only on the presentation here, but the business plan was very well done.
With moving away from a contractor, is it because of cost effective or more because you can manage what's going on?
So the benefit is, yes, definitely in the management of the staff. There's no doubt about that. And cost-wise, it's questionable, really. You know, everybody has their own set of policies. I think that every vendor that we have directly pulls from the national set of standards, and that's exactly what we would do. But I think the difference is that they have a number of risk mitigation policies in place that we may feel more comfortable allowing an employee to do under their license. So my example of that would be if we have a nurse practitioner who is trained and licensed to do stitches. Our vendor may not allow that because of the difference, for whatever reason, they may not allow that. But as an employee of the county, under that licensure, we could have her do stitches. So that would be a significant savings, so.
Sandra, do you want to just tell the committee, so in the state of Wisconsin, kind of what the lay of the land is in terms of how many counties, what methodologies do they use to deliver these services?
Sure, so in most of the counties in the state, there are vendor services that are in place, just as we've had. There are a number of counties that do utilize public health nurses in their jails, and there are a couple of counties who do employ jails directly, or jail nurses directly. And then we have people who are contracting with physicians for oversight versus having the vendor services. For the most part, I think everybody is providing good care, whatever direction. They're all using the national standards, but some of it's piecemeal, but the majority of it is the use of vendors.
Because I don't know what I don't know. Can you describe more about a vendor? What is it? Aspirus? Is it Marshfield Clinic Systems?
So there are a couple of vendors that are prevalent in the state. There's Advanced Correctional Healthcare, Southern Health Partners, and there is WellPath. Those are the three major correctional vendors, and they're really pointed to that service. There are a couple of places in the state that do pull on their local hospitals for providing the services, but mostly it's these top vendors that are going out and they're gaining the contracts for correctional care. That is their focus. That's the reason that they exist. And they are providing nurses and doctors, mid-level providers, nurse practitioners, things like that, who come in and they're stationed at the jail, and then they literally do everything from a 14-day assessment, which is what's required when somebody comes into the jail by the state, to managing pregnancies and managing blood pressures and TB cases, and essentially anything that you would go to the doctor for, they are providing that service, with the exception of specialties. So, for example, I used to go to a doctor, and most of us probably had one doctor for everything, and now all of a sudden in the last 10 years, it's, oh, you have an earache, you have to go to ENT, or oh, you hurt your ankle, you have to go to ortho. So that transition has also occurred in the jail, where they're trying to provide more rounded care like you would have in the past, but there's still the need for the specialties when somebody comes in with a broken wrist or something.
I got a question, like, so would be less, you'd have to be less transporting, like taking people to hospitals and stuff, you'd have better care is that kind of?
Yeah, so I wouldn't say better care, I would just say different policies that drive what care is allowed. And so, if you have a policy, for example, that says everyone who has, and this is just a generalization, right? Everyone who has a seizure has to be transported to the hospital. Well, we know after working in corrections for a lot of years that not all seizures can be treated medically. And so if that's a policy where we're having a transport routinely and I don't have any impact on that policy, that's different than when I do have the impact. So that is the difference that we're seeing. And I'm hoping in a new contract and understanding our new vendor better, that we have the opportunity to kind of make some of those changes up front and understand what their policies are a little bit better than, or at least understand when they're making policy changes that they have a conversation with us versus us just holding the bill on the back end.
And just to follow up, that's exactly when I was talking about, like, kind of the ancillary costs that are more difficult to really understand. That's exactly what that is. We want to make sure that we have the relationship with the vendor and we understand how that is going to work and the day-to-day interactions that can lead to the jail holding the bill for something that perhaps there might have been a different way for us to do that based on policy. The other thing I'll say is, the labor market, and we've talked a lot about labor market at the county board, hiring is difficult. It's a challenge for everybody. But if we're doing the direct care, at least we're in control of those steps we're taking to get someone to be in that position. Because like Sandra said, if our vendor isn't able to fully staff the way they need to, what that means for jail staff is that they're making arrangements for individuals to be taken to, whether it's the walk-in or the emergency room, for care that perhaps we wouldn't need to do that if we had those people on staff. So at least you're in control of your own destiny, I guess, there, for lack of a better turn of phrase, but also the policy piece that Sandra brought up. So we'll continue to evaluate that, but right now I don't anticipate us being before you for approval of a business plan to add 12 positions by July, by your next meeting, to get in front of HR Finance to hire people, because we're not going to have somebody in place by the end of July. But certainly that could change.
So is that like annual? Is that they'd renew that annually then?
That's based on the contract, but like Sandra said, we typically you'd structure those contracts to be for whatever the term is, even if they're a year, that they have the opportunity for renewal at the discretion of either party, that we can request a renewal. But yeah, they're typically longer in term than, you're not gonna do a 3-month or a 6-month contract.
Anything further? All right, thank you again, Sandra. 8, educational presentations and committee discussion. A, potential updates to the 2018 to 2022 strategic plan. So I assume Lance put this on here because we talked about it last time, and I apologize. I was supposed to call him last week Friday, but I was out of state. So I feel the strategic plan obviously is done in 2022. Now, obviously, there's going to be more work needed on a lot of this stuff. As you can see, one, it says the new strategies needed to be added to the existing objectives and plan. Should any of the strategies under your objective be prioritized? Are there any objectives or strategies from the 2016 comprehensive plan be added to the strategic plan? Now, the last time, as I said, I think I mentioned it last time, when we went through and made the strategic plan, we actually sat down with the entire board, and we had like I guess you'd call it like a retreat where we sat down and we did this as a full board. So I guess my question to Lance is going to be, isn't our process going to be to take this to the executive committee, see how we want to structure this as far as Sir Craig McEwen being the vice chair, and see how we're going to move forward before, I assume today what I would say to this committee is go through the strategic plan and the comprehensive plan if you haven't done so already, because that's kind of how our board is run. So go through those, but then I think there'll be more things to come, obviously, with the 2022 strategic plan ending. So, but go ahead.
You're entirely correct. Vice Chair McEwen, I'm pinch hitting for him today. So if you're on another standing committee, you've met last week, you've already heard this. But to Chair Boots's point, the real question for the board has been one of the strategic plan goes through 2022. So your options when your plan expires are rather simple, right? You either do a entirely new plan or you can opt for perhaps an extension. And Vice Chair McEwen met with Chair Gibbs and myself, and we came up with this kind of interim plan where we want feedback. The inclination is, let's just extend it. There's a lot of good work that has been done, but certainly the last 2 years through the pandemic, attention has been taken away from really focusing on some of those objectives and the outcome measures and strategies. Let's return to that, take an assessment of where we are, and see if there's an opportunity to extend that plan for a couple of years. So Craig McEwen, Vice Chair McEwen, has gone to each of the committees, and he has framed up these 3 questions to try to get insight from each of the committees with the intent, as Chair Boots referenced, to have a discussion at the executive committee in the next month or 2 on what that extension might look like. So when you look at the first question, what new strategies need to be added to the existing objectives to the plan? And I'll just pull up the strategic plan, and we can talk about an objective where your committee is identified as a lead committee, mitigating the impacts of heroin and methamphetamine epidemics in Marathon County through evidence-based practices. So the vice chair, in his meetings with other committees, has asked the committees to take a look at each of these strategies and try to identify, hey, are certain strategies no longer effective? Do new things need to be added to those strategies? And from the remaining questions in the packet, you'll see the kind of the iterative thought process that the vice chair is aiming for. Not only what objectives need to be added, but also thinking about, is there a priority for the strategies within each objective? They are listed A through E, but the vice chair in his previous meetings with all of the committees has made very clear that is not a priority system. That was simply the way they were listed in the comprehensive plan, and that transitioned into the strategic plan. So if you know that from your perspective, for example, it's really important that we identify and advance public policy under strategy D. That's the first thing we need to be thinking about. He wants to hear that discussion at your committee level, take that back to executive and see if that is something we want to, that this board wants to provide direction to staff on. So that's the kind of that first part of looking at those strategies, what new needs to be added, what needs to be prioritized, and then the last question to kind of round it out, are there objectives or strategies from the comprehensive plan to be added to the strategic plan? So really, these are all build on each other, but you might look through the comprehensive plan, and again, your comprehensive plan has 64 objectives and well over 200 strategies under all of those objectives. So looking through that document, maybe there's something listed in the comprehensive plan under an entirely different objective that you think really aligns itself well to objective 7.2. You might want to say, hey, let's add that. Let's add that strategy to objective 7.2. Or you might have, when you look through the 2016 comprehensive plan, those 64 objectives, you might say, the situation is fundamentally different from what existed in 2018. And while these 12 objectives are good, there's one or two things that really need to be brought forward, come from the comprehensive plan and added to the strategic plan. And I say one or two because from the staff perspective, in order to be effective, we need to be selective. 12 objectives is a lot. It's a lot for us to move forward, especially when you read the strategic plan and you see how broad these objectives are and how kind of robust all of the strategies are. So we really need to be mindful of the limited resources that exist within our staff. So that's my challenge. That's been my challenge to the vice chair in his conversations with all of the committees. But I'll give you a little bit of the flavor of discussion at some of the previous committees to illustrate the point that the vice chair is trying to get at with respect to adding new objectives or new strategies from the comprehensive plan to the strategic plan. And when you look at the comprehensive plan, and it's available online, and for new members, I do have hard copies. Several members requested the hard copy printouts, so if you want one, just hang around after the meeting and I can get you one. But two examples that the vice chair brought up, and that came up at Health and Human Services, for example, two of the things that you've heard a lot about recently are housing, a lack of housing, and childcare. And actually, those were things that the full board in their 2016 comprehensive plan, you actually had those things listed as long-term priorities, but they didn't rise to the top of that exercise that Chair Boots referenced in 2018 when you identified 12, but maybe they should now in light of things that have changed. So that was one example that Health and Human Services brought up, was they brought up objective 4.1 from the comprehensive plan, which you'll see on your screen, is promoting a variety of safe and affordable housing options that meet the needs of all community members. So look through the comprehensive plan, and maybe you think there's a different objective than 4.1. I'm just giving you an example, but the example that Health and Human Services gave was, hey, we think we need to do something around housing. So if that's the case, the board could move that forward and have that essentially added to the existing strategic plan and extend that strategic plan for a set period of time. The other example that I already referenced, which you've probably seen in the news, surrounds childcare. You know, that again, credit to the board in 2018, you had a very robust comprehensive plan. You anticipated a lot of things that would come up, but childcare as a strategy under objective 10.1, objective 10.1 didn't rise to the top of the strategic plan discussion. It wasn't identified as one of the 12. But maybe the idea is, and this was the example that the vice chair gave, maybe we take that strategy, develop policies that support affordable, high-quality childcare, and we add it to an already existing objective. Objective 3.3 perhaps, or our objectives around economic development, recognizing that childcare plays both a very important role as it relates to Objective 3.3, ensuring that every child makes it to adulthood with health, stability, and growth opportunities, but also recognizing that childcare, or the lack of childcare perhaps is a better way to put it, actually has significant impacts on the availability of skilled and flexible workforce. It's forcing people to choose between staying home with their children or re-entering or entering the workforce. So Vice Chair McEwen's example is maybe that's something that we bring forward in terms of a strategy, both under 3.3 and 10.6. Again, those are just two examples, but the thought process that the Vice Chair is looking for is for all of the committees to have some homework, go back and read your strategic plan and your comprehensive plans again before your next meeting, have that discussion at your next meeting, and then Chair Boots would bring the suggestions from this committee back to the executive committee to kind of come up with a comprehensive, pardon the use of that term again, but a larger picture of what we want to incorporate into that extension of the strategic plan. So with that, I did a poor impression of Chair McEwen. He does that spiel a lot better than I just did, but happy to try to answer any questions you might have in terms of what the Vice Chair is looking for.
So I kind of understand, I obviously talked to Craig quite a bit about this, but the one thing I guess I'd like to see, if I look through this and just by what he pointed out, it says what new strategies need to be added, should any of the strategies be prioritized, la-di-da. If you under your strategic plan, I guess the first thing I would ask Craig is, in every one of our objectives, we have our outcomes. And in our outcome measures, by December 2020, or most of them are December 31st, 2022. But let's be honest, we can come up with something right now. It's only 4 months away, 5 months away, whatever it is, 6. Where are we at? So if we look at you were looking at 7.2, and if you go to 7.2 and you go to, by March 1st, 2019, an outcome measure that will be established to measure the quality of life for adults, and have we done that? By December 31st, 2022, 3% or less of high school students in Marathon County will report having taken prescription drugs without doctor's prescription. Have we done any of these, looked at any of the outcome measures? Because let's be honest, that's what we're looking at when we do our, to see if we're actually accomplishing our goals.
Great question, and as a perfect example of why I did a poor job than Vice Chair McEwen on giving you the overview. He has asked that staff bring forward kind of a where are we now? So I have reached out to all of the departments that are the leads for each of these 12 objectives and asked them to do a couple of things. First, with regard to all of the strategies across the top, if there are strategies that we believe we've accomplished. For example, under 3.3, just to, because I know exactly where we are on a couple of these strategies, developing a plan to reduce childhood trauma, strategy A and strategy E, which is very similar, that the county board approves such a plan. I know that the county board approved that in either April or May of 2020. So I have staff going through and looking at each strategy and saying, where are we on those strategies? What have we done? Essentially building on the 2020 annual update that we talked about last time. And then to your point, Chair Boots, I have them trying to identify where are we as the most up-to-date information we have with respect to each of the outcome measures. I've asked them to get that information by the end of this month. I don't know, quite honestly, if that's a reasonable request. I haven't heard any strong pushback as of yet, so my hope is that I will be able to have some updated information to you, if not in July, certainly by August, where we are on all of the strategies and all of the outcome measures, but my hope is to have it to you in July. Essentially what it's gonna do is, again, build on the 2020 annual update, which is available online. And I've asked them to do the very similar thing with respect to the 2020 update. With under each objective, you'll recall, for example, under 3.3, one of the things we highlighted was the mental health, school-based mental health consortium. So I asked them to look at, okay, is there any information that was in the 2020 update that you want to add to as it relates to that specific initiative? So my hope, again, is to have that package before you. It's certainly not going to look as nice as the 2020 update, but I'll get you the information from each of those things.
Thanks. So yeah, I guess at this point, that's what I guess, like Lance said, look at the strategic plan, look at our comprehensive plan, bring things forward that you think maybe we need to look at. I don't know how it's gonna move forward this time. Like I said, 5 years ago, we did like a retreat. I don't know how we're gonna move forward with it this time. Maybe it's gonna be the same thing. I don't know that. And I guess that would be something that's gonna be brought up in the executive committee when we discuss what all the committees came forward with.
And the only other thing I'll add is Vice Chair McEwen has referenced that he's going to be in contact with all of the vice chairs from each of the committees, because they were designated as kind of the shepherding the strategic plan within each of the standing committees. So if you're the vice chair, be ready for, Supervisor Mask, be ready for a call from Vice Chair McEwen about that.
Oh, yes, I've already been talking to him.
And just so everyone else is aware also, just because we have it in our strategic plan or we don't have it in our doesn't mean we don't work on it. It's just like our priorities is like an overview on everything. So if we look at the like 7.2, mitigate the impacts of heroin and methamphetamine epidemics in Marathon County through evidence-based practices. Now, I always find it, I wouldn't say humorous, but it seems like there's always a tone to every NACO conference that I go to. And it seems like every year it's like, what's the topic that's hitting most of the counties in the nation? And opioid epidemic was a huge one, I'd say 3 years ago. Like that's all you heard about. You're still hearing it, but actually fentanyl is the new one coming down. It's not so much the meth and the heroin, which I'm not saying it's not there, but now it's the fentanyl and what the fentanyl is doing to the systems. So that's just kind of the trend. You see them when you go to these conferences, so. Any questions for Lance or for Gene or myself, or even Al? He's been here quite a few years dealing with the strategic plan. But at this point, I think it's just more of a learning process just to kind of read through it. And then hopefully, like Lance said, he'll get some more outcome measures of where we're at with some of that stuff. Okay.
If I may, sorry to, you were almost done. Another good place to look, the vice chair referenced in his previous meetings, the life report, if you're looking for kind of trying to understand what are the challenges facing the community, because that's really what this is, right? It's trying to identify what are the new things that we need to be working on. You can look at the life report, which is available online. It's a publication from the United Way of Marathon County. But also, I would, as Chair Boots referenced, looking at the National Association of Counties, a lot of their materials will show you, they'll have materials that are put out addressing the big issues of the day. I already referenced a couple of them, but housing and childcare are not only issues for Marathon County, but looking at the National Association of Counties and also the Wisconsin Counties Association, that might help inform you as you move forward and say, what are the things we really need to move to the top of the list? And it's perfectly acceptable to say nothing. If you believe the plan is solid as it exists and that staff are working on the things that are most important based on the strategic plan as it exists, that's completely fine. One thing as it relates to Objective 7.2, for those of you, I know many of you participate in the Wisconsin Counties Association weekly leadership calls. Finding out how we're going to allocate the opioid settlement funds is going to be one of the big conversations that the counties need to have. So you're very familiar with the American Rescue Plan Act, and the county's got a process through the HR Finance and Property Committee for reviewing project submissions. The opioid manufacturers, distributors, those settlements, the first of those settlements is forthcoming in Marathon County. Off the top of my head, I want to say it's about $3 million that we're going to need to make a couple of important decisions on. The board is going to need to make a couple of important decisions on. That could be something that you identify as a strategy perhaps to add. But again, I just use that as an example to be illustrative, not to try to say, hey, you need to add that. But if you do have any questions, please don't hesitate to reach out to me at any point.
Is that something, I guess, now that Lance mentioned that, do the new members know about that litigation? No?
It was brought up in our orientation, I think it was actually talked about.
I think maybe what we'll do, because it does affect 7.2 and that's, I think we should have a presentation of what that actually was, because that was back in the day, the Wisconsin Counties Association itself, instead of letting legislature, the state representation go after these opioids, the counties did. Because that's where the dollars, we wanted the dollars to go around the state and come right to us. So we'll do a presentation on it, because I think that's very important.
Is that money gonna be used for dealing with the drug epidemic?
Well, I shouldn't say that. We'll get the money. I don't think, is it earmarked? Does it have to be earmarked for opioid type things?
It does have some language within it that is restrictive relative to use. Not only, it has to address the epidemic of opioids. The only other thing I'll say, one of the big decisions that the counties are gonna need to make, that payment, that settlement is structured, I believe it's 18 years? Is that right? Yeah. So it's structured over 18 years. So one of the questions you as the board are gonna need to address is, should we securitize that? So, getting money paid out over 18 years, do you want the present value of that money now? There are companies that do that, that will pay you X dollars to essentially buy out that long-term repayment. And there are a lot of reasons to do that, and there are reasons not to. And if you've been on the Wisconsin Counties Association leadership calls, they've started to have those discussions, and I believe another one is coming up next week, where that again is gonna be the topic of discussion on Monday. One of the big reasons to look at it is one of risk. Are the companies that were the subject of the settlement, subject of the suit, are they going to exist 16, 17, year 18? There's certainly, Wisconsin's not the only party to that suit. They're not the only party to that settlement. And there are other legal actions that may come from that. So all questions that the county board is gonna need to delve into, certainly staff are here to help get you information, and we will certainly make a recommendation to you on what we think is the prudent financial decision to make, but at the end of the day, that is gonna be something that we approach the board about. But if you do have any questions, certainly can get you that, and we can have a presentation at an upcoming meeting. Quite honestly, Chair Gibbs has been one of the most active county board chairpersons in the state, and most informed on that, so we can certainly have that presentation done.
All right, we're going to move on to 9, next meeting time, location, announcement, and agenda items. Committee members are asked to bring future ideas for future discussion. Next meeting is going to be Tuesday, July 12th at 1:30. I guess I will take number 10. A motion to adjourn? Motion and second it. All in favor? Aye. Any opposed?
Aye.
Motion carried. Thank you, everyone.